Hello, everyone, and welcome to another edition of A Grain of Truth, the Gluten E Summit. And I am absolutely delighted to be here today with Dr. David Perlmutter, board-certified neurologist and fellow of the American College of Nutrition, recognized for his cutting-edge approach to preventing and working with neurological conditions by addressing their root causes. Dr. Perlmutter is a frequent lecturer at symposia sponsored by such medical institutions as Harvard University, the University of Arizona, Scripps Institute, New York University, Columbia University, ... He has contributed extensively to the world medical literature with publications appearing in the Journal of Neurosurgery, the Southern Medical Journal, the Journal of Applied Nutrition, the Archives of Neurology. He is the author of many books, including the Better Brain book, Raise a Smarter Child by Kindergarten, Power Up Your Brain, The Neuroscience of Enlightenment, and most recently, Grain Brain. I personally recommend Raise a Smarter Child by Kindergarten to every new parent. In 2002, Dr. Perlmutter was the recipient of the Linus Pauling Functional Medicine Award for his pioneering research and clinical work on the role of diet and nutrition in brain-related disorders, and the American College for Advancement in Medicine's Denham-Harmon Award for his innovative work on free radical science and its application to clinical medicine. In 2006, Dr. Perlmutter was the recipient of the National Nutritional Foods Association's Clinician of the Year Award. And in 2010, he was awarded the Humanitarian of the Year Award from the American College of Nutrition. Dr. Perlmutter serves as a medical advisor to the Dr. Oz Show and has been interviewed on many national radio and television programs, including CNN, The Today Show, and Oprah. Dr. Perlmutter, thank you so much for joining us today.
Well, Dr. O'Brien, it's my pleasure. Thank you for having me.
My first question to you, Dr. Perlmutter, you are one of the world's premier neurologists teaching doctors the big picture of how to diagnose their patients, how to find the underlying triggers to the problems that the patients might be presenting with. How important is inflammation in that line of thought?
Let me take a step back if I could. Just a thought occurred to me while you were asking that question in terms of being a diagnostician. And it's a quote that comes from Louis Pasteur that says that chance favors the prepared mind. And the reason I was thinking about it while you were doing that introductory question is because when you prepare your mind, when you explore other ideas, then you enhance your chances of making that right discovery that can have a major impact on that individual patient that you might be treating that day. That said, even broadening a person's perspective, a healthcare practitioner's perspective, to understand the fundamental role of inflammation in areas that I am particularly interested in, like neurodegenerative conditions, really expands not only the understanding, but the therapeutic options, not only in treating neurodegenerative conditions, but actually preventing them. So the question was, how important is inflammation? Inflammation is the cornerstone of Alzheimer's, obviously multiple sclerosis, and also things like Parkinson's. These are fundamentally inflammatory diseases of the brain. And, people don't really recognize that because we're all familiar with the cardinal issues of inflammation, of swelling and redness and pain. But when your brain is inflamed, you're not going to feel it. You're not going to know. But absolutely, all of the chemical markers of inflammation that you might have in an arthritic knee are the exact same players that are involved in the disease that we call Alzheimer's. So where do we go with that information? Well, right off the bat, we can get a leg up on preventing Alzheimer's disease. And again, what did I just say? Preventing Alzheimer's. No one wants to talk about that, but the Lancet Neurology just published a report saying that more than 54% of the current Alzheimer's patient load in the world could have been prevented if specific lifestyle issues would have been addressed. And in this country, that represents about 2.6 million people right now who carry a diagnosis of Alzheimer's, a disease for which there is no treatment or cure, that didn't have to be in that situation in the first place. To get back to your question, how important is inflammation? It is absolutely fundamental. Now, people are beginning to get, and I'm giving you the short answer here, people are
Fine.
beginning to get this notion that there's some relationship between Alzheimer's and dysregulation of blood sugar. In fact, to the extent that some people go as far as calling Alzheimer's disease diabetes type 3 because of this profound relationship. And it turns out that this does wonderfully relate back to your question, because it is true that there's this direct relationship between blood sugar elevation and Alzheimer's. As a matter of fact, just last week in the New England Journal of Medicine, a powerful study was published demonstrating even mild elevations of blood sugar, just a little bit north of 100, already correlate with risk of dementia. We know that elevations in hemoglobin A1C are directly correlated with shrinkage of the hippocampus, or the brain's memory center. But how does this relate to inflammation? I'm going to bring it back around. When your blood sugar is even mildly elevated, it raises a process called glycation. And glycation is the process by which that mild elevation of blood sugar binds to proteins. When blood sugar is elevated and binds to proteins in this process called glycation, two bad things happen. Number one, it dramatically increases the production of chemicals that are called free radicals, which damage everything in sight. And number two, glycated proteins, or proteins that are bound to sugar, dramatically increase the process of, as you mentioned, inflammation. And this is devastating for the human brain. So, in a very real sense, we can control the set point of inflammation in our bodies, not by necessarily eating turmeric and taking anti-inflammatory medications. I mean, I'm all for using turmeric and other herbs and omega-3s, etc. But step one, the biggest issue, is to cut back on the carbs. It's the carbs that are the killers, fundamentally, because ultimately a high carbohydrate diet leads to this modification of proteins that dramatically increases inflammation and the production of damaging free radicals, which damage our DNA, our fat, our protein, and really every part of the body. So, again, you know, it's interesting to talk about food allergies, food sensitivities. I know we're going to be talking about gluten in just a bit, and but the big issue, the thing that is of importance to 100% of humans on this planet, is the excessive carbohydrates in our diet. And, you know, that said, where I'm going with this is really, what is the ideal diet? And we'll get to the gluten-free part in just a moment. But the ideal diet in terms of macronutrients of protein, carbohydrates, and fat is an extremely low carbohydrate, high fat diet, eating more fat and dramatically reducing carbohydrate. And it's a revolutionary, brand new diet. It's only been just the past 2.6 million years that people have begun to eat this food.
That is a brilliant summary. And for our listening audience, one of the things that you heard from me already is that fat is not bad for you. Bad fat is bad for you. So, Dr. Perlmutter, what types of fats would be good fats to consider in the diet?
Always an excellent question. And I do digress, I guess. I didn't realize I did, but I do. Let me start with, again, the importance of fat, and we'll talk about good and bad fats. So fat is a fundamental player as an energy source in human physiology. But beyond that, it is a fundamental structural component of really every part of your body, but most importantly, the membranes of the cells, and some of those cells happen to be nerve cells. The membranes are made from fat. Healthy cells require healthful fats.
For our listening audience, the membranes are the walls of the
exactly.
cells.
Well, the walls, I guess, not exactly a cell wall, but that's correct. So that said, the cells, your brain cells, your body cells, are constructed from the fats that you elect to consume. Now, when a person is consuming very highly modified, long shelf life types of fats that you find on the grocery store shelves that are there month after month and have been modified in such a way that they will not go rancid, those are dead fats. They're damaging fats, they'll destroy the brain, and it's really what we need to absolutely avoid. The good fats are the wonderful monounsaturated fats, fats like olive oil, coconut oil, avocado, wonderful fatty food, even grass-fed beef if you choose to eat beef, wild fish as opposed to farm-raised fish, nuts and seeds, wonderful fats to add to your diet every single day. And you know, the main pushback I think that people experience or conceptualize in terms of these recommendations of improving or increasing your fats is, first, recognize that pretty much everybody has about 35% of their calories from protein. So the variables here are either a low-fat diet, which became popular in the early 1990s, at which point diabetes rates exploded, or a high-fat diet. When a person goes low-fat, where do you fill in those calories? You fill them in with carbohydrate. If you're high-fat, then you're cutting back on your carbs, and I absolutely favor that. And it's not just, Tom, that you have me on as a guest today and we're talking about what are my preferences and you wonder why. I mean, here I am a guest on this program, and where did I dream this up? Well, you know, there's a whole paleo movement that attaches itself to a high-fat, low-carb diet for a number of reasons, but I think it's really relevant that we go back and look at what is the peer-reviewed science telling us about what is really best for human physiology. The main pushback for people eating high-fat is they somehow have this perverse idea that this is going to cause heart disease, and nothing could be further from the truth. People say they're going to go on a low-fat diet because that's going to help them lose weight, and again, nothing could be further from the truth. The science doesn't support that. When you look at what was published in the New England Journal of Medicine back in 2008, there was actually a study called Weight Loss with a Low-Carbohydrate Diet, Mediterranean Diet, or a Low-Fat Diet. Head-to-head competition. Let's look at the science and see what happens to people. They took 322 moderately obese adults, average age 52 years, and they put them on one of these three diets, low-fat, low-carb, or Mediterranean. And obviously the extremes were the low-fat versus low-carb. Low-fat is really the diet du jour. It's what everyone's telling you to do. Just last week, former President Bush had a placement of a cardiac stent, and when the program, after the segment was aired on national news, the media advisor for the national network said, once again, what we really need to emphasize to people is they've got to lower their carbohydrates and absolutely reduce their intake of dietary fat. That's not fair because it's not based on science. It's based on mythological information that comes to you courtesy of people who have interest in making sure we eat a high-carb diet. So if you're eating low-fat, you're eating high-carb. Let's go back to the New England Journal of Medicine study. What they found was in the 2 years when you compared the low-fat versus the low-carb diet, those who ate low carbohydrate had a dramatic and a significant increase weight loss and kept the weight off much more aggressively than the people on a low-fat diet. The HDL, or so-called good cholesterol, went up dramatically in people eating lots of fat. The triglycerides are a powerful marker of risk for cardiac events. The triglycerides dropped 23.7 points in people eating a lot of fat and low carbs. 24 points. In people on the low-fat diet that doctors will tell you to go on for triglycerides, the triglycerides went down 2.8 points, 1/10 of what they went down in people eating a lot of good fat. Fasting insulin was far better in individuals eating lots of fat, as you would expect, because they're cutting back on their carbs. LDL, or bad cholesterol, reduced by 3 points in people eating a lot of fat and not even anything statistically significant in people on the low-fat diet. So really across the board, and perhaps from my perspective, most importantly, what improved so dramatically in people eating a high-fat diet was that their C-reactive protein went down dramatically compared to people on a low-fat diet. And that gets back to exactly what you asked me in the first place. What is the importance of inflammation? Now, C-reactive protein, for your listeners, is a blood test that many doctors perform because it's a marker, a blood marker of the activity of inflammation in our bodies. The higher the C-reactive protein, the higher is this process we call inflammation. And having said that, this study, published in probably, arguably, the most well-respected medical journal on the planet, showed in an interventional trial, in other words, where they gave people something, diets to stick to, showed that the best diet to reduce inflammation is a high-fat, low-carb diet. Inflammation is the cornerstone of coronary artery disease and Alzheimer's, and obviously any number of other problems. So again, it's great for us to talk about, people's ideas, but I think it's really far more important that we go toe-to-toe with what people are being told and look at what is the mainstream science telling us, the best well-researched studies are telling us about what we should be eating.
That's an amazing summary of the current research, and it's so consistent with the conversation we had with Dr. Mark Houston with the science from the cardiovascular and vascular biology point of view. High-fat diets are recommended once again. That's quality fats. It is.
Isn't it amazing that?
It's amazing, to keep coming back to what makes sense and what the studies are telling us. And it doesn't matter if you hear it from a gastroenterologist or from a neurologist or from a cardiologist. For those specialists who are reading the studies and staying current on what is right out there being proven, a high-fat diet with quality fats and lowering your carbohydrates works time and time again.
Without question. And, basically, again, this is the diet that we have eaten for 99.99% of our time on this planet. And so we've always been exceedingly low in carbohydrates. Where would we have gotten carbohydrates as hunter-gatherers? Maybe in the late summer or early fall when some wild blueberries or raspberries were finally ripened and they were sweet, we would consume those carbohydrates, and that would stimulate the body to produce insulin, whose primary job it is to cause the body to make and store fat. And in the late summer and early fall, we need to start storing fat because winter's coming and we have to make it through the winter. Well, winter's never coming for us today. We don't need to be packing on fat because it's not going to be a time of food scarcity. But yet, people are challenging themselves with high levels of carbs and sugars day in and day out, stimulating their bodies to make insulin, making and storing fat for the winter that never comes. So, people say, oh, I have a sweet tooth. You know what? Everybody on the planet has a sweet tooth. It's why we're here. It's why we survived, because, in fact, we were able to make it through times of food scarcity because we did eat carbs from time to time. We were drawn to sweet foods, meaning ripened fruit, basically. It's the only carbs that were available. We were drawn to them because that's, oddly enough, when that fruit has the highest level of vitamins and other things that are good for us. And frankly, it was actually good for the fruit as well, because when fruit ripens, its seeds are ready to be spread. So what a beautiful symbiotic picture that does paint. Nowadays, we're using that same mechanism in our brains to seek out sugar and carbohydrates to our absolute destruction in terms of our health. I mean, you just look around. Go to an airport when you're traveling, and just all you see are people who are very, very ill appearing, and signs at the airport that say terminal. So it's kind of a moment to take a deep breath. So it's an interesting time.
It is, and it's such a wonderful explanation you just gave, which I've not heard before, quite honestly, is that the carbohydrates, the high concentrated carbohydrates that our ancestors had access to, were the fruits that were ripening in the fall. So our ancestors would eat more of these fruits because they were available, and they'd put on a little extra fat because here comes the winter. And it was a beautiful dance. And
yes,
today...
it was. And we're saddled with that genetic issue, and we have to adjust to make it work. But what got me to that place is that the genome that we have now was selected for the past 2 million years, or at least the past 50,000 years, because it's the genome that allows us to survive in that environment, which was high fat from game that we killed, low carbs. We never, ever had access to carbohydrate. We didn't have wheat, gluten, the hybridized fruit, and not to mention all the rest of the, highly processed foods that are so abundant today. I mean, wheat as a carbohydrate, before we even get to the gluten issue, wheat products represent 20% of the calorie ingestion of humans on the planet today. And those calories are virtually pure carbohydrate. There is some minimal amounts of residual fat and protein, but basically, the breads and the pastas are carbs.
Dr. Perlmutter, in an article that you recently published in Integrative Medicine,